السلام عليكم ورحمة الله وبركاته. أعزائي طلبة المرحلة الثانية، اليوم محاضرتنا عن ال Triangles of the Neck. مثل ما تذكرون بالمحاضرة السابقة أخذنا في muscle اللي هي نعتبرها كلاندمارك in the neck. This muscle is the sternocleidomastoid muscle. Sternocleidomastoid muscle. Why it is called the sternocleidomastoid muscle? Because due to its attachment to the sternum, clavicle, and the mastoid process, we call it the sternocleidomastoid muscle. This key muscle in the neck that extend obliquely across the side of the neck will divide the neck into two triangles, the anterior triangle and the posterior triangle. The anterior triangle here, this is in the green color, and the posterior triangle, this is in the blue color, they are further subdivided by the presence of this muscle. هذه هنا عندنا واحدة من العضلات اللي هي نسميها digastric muscle. Digastric muscle, and another muscle that is called omohyoid. Omohyoid. Digastric muscle because it have two belly. It have anterior belly and posterior belly. We call it digastric muscle. And the omohyoid muscle, omo it means shoulder, and the hyoid it means attached to the hyoid bone. So this muscle, omohyoid muscle, extend from the shoulder to the hyoid bone. We call it the omohyoid muscle. This muscle will further divide the anterior and posterior triangle into a further smaller triangles. These are, in the anterior triangle, we have the submandibular triangle, submental triangle, carotid triangle, muscular triangle, and the posterior triangle divided by the inferior belly of omohyoid into the occipital triangle, the upper one, and the lower one is the supraclavicular triangle. First, we will take the anterior triangle. Anterior triangle, this is bounded by the lower border of the mandible, the sternocleidomastoid muscle, and the midline of the neck anteriorly. There are further subdivision of the anterior triangle, as we said, by the presence of this muscle. We can divide the anterior triangle into a submental triangle, submandibular, carotid, and the muscular triangle. Another classification, we can divide the triangles in the neck into a group that are above the hyoid bone. We call it the suprahyoid triangles. And the group of triangles that lie below the hyoid bone, we can call it infrahyoid triangles. So, the suprahyoid triangle, these are the submental and the submandibular. The infrahyoid group of triangle is the carotid and the muscular triangle. First, we will take the submental triangle. This triangle is bounded by the two anterior belly of the two digastric muscle, and its base is formed by the body of the hyoid bone. Its floor is formed by this muscle that is called mylohyoid muscle. Mylohyoid muscle. What are the content of this triangle? It contains the submental lymph nodes and the beginnings of the two anterior jugular veins. We can see that this triangle, the submental triangle, is situated at the midline of the neck, at the midline of the neck, yes, and its apex is directed toward the chin. Next, we have what we call the submandibular triangle. Submandibular triangle situated below the mandible, situated or bordered by the mandible, the anterior belly of the digastric muscle, and the posterior belly of the digastric muscle. You can see here, this is the anterior belly, and this is the posterior belly of the digastric muscle, and this is the inferior border of the mandible. These are the boundaries of the submandibular triangle. Its floor is formed by the mylohyoid muscle, and another one posterior to it is the hyoglossus muscle. Hyoglossus, this muscle, it means it extends from the hyoid bone to the tongue. What are the contents of the submandibular triangle? To contain the submandibular gland, submandibular lymph nodes, facial artery which lie deep in this triangle, facial vein, the hypoglossal nerve, and the nerve to the mylohyoid muscle. Another triangle is the carotid triangle. Carotid triangle that is bounded by the red line. Carotid triangle is bounded by superior belly of the omohyoid muscle, the posterior belly of digastric, and the sternocleidomastoid. This is a vascular triangle, and we will see why it is vascular. What are the contents of the carotid triangle are to contain the carotid sheath that contain the internal jugular vein and the carotid artery and the vagus nerve. So the content will be the common carotid artery which bifurcate into the external and the internal carotid arteries. The branches of the external carotid artery, and all the branches of the external carotid artery here, except the posterior auricular artery. We can see here the superior thyroid artery, the lingual artery, facial artery, occipital artery, ascending pharyngeal artery. All these are branches from the external carotid artery, except the posterior auricular artery. The internal jugular vein, the hypoglossal nerve, and the vagus nerve. Hypoglossal and the vagus nerve. Here we have a branches that is called internal and external laryngeal nerves. Internal and external laryngeal nerve that will supply the larynx. So these are the content of the carotid triangle. Here we can see the boundaries. These are bounded by the posterior belly of digastric, inferior belly of omohyoid, superior belly of omohyoid, and the sternocleidomastoid, and these are the content. Common carotid artery with its bifurcation, external carotid artery with its branches, internal jugular vein, hypoglossal nerve, and the vagus nerve. That is the branches of the external vagus nerve is the internal and external laryngeal nerve. The muscular triangle. Muscular triangle, here we can see it is bounded by the midline of the neck, by the superior belly of omohyoid, and the lower part of the sternocleidomastoid. Why it is called muscular triangle? Because it is covered by muscle. From the first look, we can see this is the muscular triangle here. It is bounded medially by an imaginary line of the neck from the hyoid bone to the jugular notch. This is the medial boundary. Superolaterally is by the superior belly of the omohyoid muscle, and inferolaterally is by the sternocleidomastoid muscle. We can see here that there are muscles in this triangle. At the midline, we can see that this is the larynx, and this is the thyroid gland, and this is the trachea. These are among the content of the muscular triangle that lies deep to these muscles. What are the contents of the muscular triangle from muscle? These are the omohyoid, sternohyoid, that's extended from the sternum to the hyoid bone, sternohyoid. If we remove the sternohyoid muscle, we will expose two muscle. Here they are. These are sternothyroid that extend from the sternum to the thyroid cartilage, to the oblique line of the thyroid cartilage. واللي تكملها العضلة الثانية اللي هي thyrohyoid, from the thyroid cartilage to the hyoid bone, from the oblique line on the thyroid cartilage to the hyoid bone. It is called thyrohyoid. So these are the content of muscular triangle. These are the muscle here: omohyoid, sternohyoid, sternothyroid, and thyrohyoid. What are another content? If we remove the muscle, if we remove these muscles, we will find parts of the larynx، يعني راح تكون الحنجرة، parts of the larynx واللي تكملها التراكية، parts of the larynx and trachea. Behind them we will find the pharynx and esophagus and the thyroid gland والمرتبطة بها الباrathyroid glands. So these are the deep content of the muscular triangle: parts of the larynx and the trachea, parts behind them, parts of pharynx and esophagus, the thyroid and the parathyroid glands. هسه نجي إلى فد موضوع هي المسل of the neck، ونقدر نقسم المسل of the neck into suprahyoid and infrahyoid muscle. Muscle that are above the hyoid bone, these are the suprahyoid muscle. These are stylohyoid muscle, digastric, mylohyoid, and geniohyoid. Infrahyoid muscle, or another name is the strap muscle. These are omohyoid, sternohyoid, sternothyroid, and thyrohyoid. بشكل أوضح هنا قاعد نشوف هنا مثلا عندنا هاي suprahyoid group of muscle. عندنا this is the digastric muscle as we said before. Digastric because it have two belly, anterior belly and posterior belly. The anterior belly originating from the body of the mandible, the posterior belly originating from the mastoid process. They are connected by a sling to the hyoid bone. Stylohyoid muscle from the styloid process to the hyoid bone. Mylohyoid muscle that form the floor of the mouth اللي هي باللون البنفسجي, extend from the mylohyoid gland of the mandible to the body of the hyoid bone. It will form the floor of the muscle. Next to it is the geniohyoid. Genio, it means the angle. So it extends from the angle of the mandible here to the hyoid bone. So we call it geniohyoid. All these muscles are called the suprahyoid muscle. مثال هذا عندنا قلنا عندنا digastric muscle. That means the muscle that with two belly, anterior belly and posterior belly. Origin, the anterior belly from the body of the mandible, from the digastric fossa. Posterior belly originating from the mastoid process of the temporal bone. الانسيرشن هنا راح يكون عندنا بالوسط. There is an intermediate tendon is held to the hyoid bone by a fascial sling. Nerve supply is through the facial nerve, and the action it will depress the mandible. يعني إذا سحبت هذه anterior الانتيرير خلينا نقول الانتيرير or posterior belly to either it will depress the action of either depress the mandible or elevate the hyoid bone. The infrahyoid muscle هنا as we said before, this is the sternohyoid, هذه هي الأوموهyoid superior belly or inferior belly, and this is the thyrohyoid muscle. And here we are removing the sternohyoid muscle. If we remove the sternohyoid muscle, we will expose these are the deeper two muscle. ناخذ كمثال عندنا الأوموهyoid muscle. As we said, it extends from the shoulder. Omo, it means shoulder, to the hyoid bone. Origin, the superior belly, this one, from the lower border of the body of the hyoid bone, while inferior belly from the upper margin of the scapula and the suprascapular ligament. The insertion here we can see there is an intermediate tendon here is held to the clavicle and the first rib by a fascial sling. Nerve supply is through ansa cervicalis, and the action it will depress the hyoid bone. Now we come to a structure that is called the ansa cervicalis. Ansa cervicalis here in Latin it means handle of the neck. Handle of the neck. هذه loop. So ansa cervicalis, this is a loop of nerve. Loop of nerve. Lies superficial to or within the carotid sheath. يعني راح تكون superficial للcarotid sheath, or sometimes it is within the carotid sheath. carotid sheath اللي هو يحتوي internal jugular vein والcommon carotid أو internal carotid artery. So either it lies superficial or within the carotid sheath in the anterior triangle of the neck. هذه هي الأنسا cervicalis or the handle of the neck, and we can see it is a loop of nerve formed from a superior root and inferior root, and it is superficial to the carotid sheath in front of these blood vessels, internal jugular vein, and the common carotid artery. The superior root that is formed from the C1 cervical nerve, ventral ramus, or it is called descendens hypoglossy. هذا C1, why it is called descendens hypoglossy? Because it will associate with the hypoglossal nerve. Hypoglossal nerve اللي هو 12 cranial nerve. هذا هو الروت الأبر روت اللي هو بدايته من C1. It will associate with the hypoglossal nerve اللي هو 12 cranial nerve, and this C1 will supply the geniohyoid and the thyrohyoid muscle. The inferior root اللي هو قاعد نشوفه هنا it is formed by C2 C3 ventral rami, وراح نسميه هو lower root أو inferior root. أصلا من C2 C3 ventral rami cervical nerve, or it is called descendens cervicalis. Supply the other infrahyoid muscle. Infrahyoid muscle اللي هي inferior belly of the omohyoid, sternohyoid, sternothyroid, and the superior belly of omohyoid. إذن الأنسا cervicalis, this loop of nerve, it will supply the omohyoid, sternohyoid, sternothyroid, except the thyrohyoid muscle اللي هي هذه thyrohyoid muscle. هذه it is innervated by the C1 قلنا via the hypoglossal nerve. يعني كأنه C1 vertebral ramus will pass with the hypoglossal nerve, but it will give a branch to supply the thyrohyoid and the geniohyoid. Now, the last part of our lecture today is about the posterior triangle. The posterior triangle, as we said before, is bounded by the sternocleidomastoid muscle anteriorly and the trapezius muscle posteriorly and the middle 1/3 of the clavicle inferiorly. by the presence of the inferior belly of omohyoid will divide the posterior triangle into upper larger triangle, which is called occipital triangle, and a smaller lower triangle that is called supraclavicular or subclavian triangle. What is the roof of the posterior triangle? And what is covering the posterior triangle? Here we can see the skin and superficial fascia is covering the posterior triangle. With the superficial fascia, we have the platysma muscle. This is the platysma muscle covering the posterior triangle. Also, we have the investing deep fascia, also covering the posterior triangle. What is the floor of this triangle? It is formed from above downward by certain muscle that form what we call the prevertebral muscle that is covered by prevertebral fascia. From above downward, the floor of the posterior triangle is formed by the semispinalis muscle, splenius capitis, levator scapulae, scalenus medius, and scalenus anterior. All these muscles are arranged from above downward to form the floor of the posterior triangle. It's covered by prevertebral fascia. What are the contents of the posterior triangle here? We can see that the external jugular vein will pierce the investing layer of deep cervical fascia and pass through the triangle to drain into the subclavian vein. Also, we have these are the branches of the cervical plexus. Also, one of the content of the posterior triangle. In general, what are the contents of the posterior triangle? These are, we have arteries, veins, nerves, and lymph nodes. We have the occipital, transverse cervical, suprascapular, and subclavian arteries. Veins, transverse cervical, suprascapular, and external jugular veins. nerves موجود عندنا الاكسسوري نيرف cervical plexus branches and the brachial plexus نقدر نقول roots and trunks. The inferior belly of the omohyoid muscle also regarded as one of the content of the posterior triangle that divide it into upper and lower triangle, and there are certain lymph nodes. قاعد نشوف بهذه الصورة. This is the posterior triangle, this is the sternocleidomastoid, and this is the trapezius, and here lower down this is the middle 1/3 of the clavicle, and these are the contents. This is the occipital artery. These are branches of cervical plexus. This is the accessory nerve, spinal accessory nerve, spinal part of accessory nerve, and there are lymph nodes here. This is the inferior belly of omohyoid that divide the posterior triangle into upper occipital triangle and lower supraclavicular triangle. These are the roots and the trunks of brachial plexus. This is the subclavian artery and subclavian vein. Also from other contents here we can see these are the occipital lymph node, the occipital artery, cervical branches of cervical plexus, spinal accessory nerve, your 11th cranial nerve, and the lymph node here we can see. Also the nerve of brachial plexus that originate from the root and the trunk. عندنا مثلا dorsal scapular nerve, nerve to subclavius, suprascapular nerve. هذا طبعا ال trunks of the brachial plexus. Here we can see the subclavian artery and the subclavian vein, and the external jugular vein is draining into the Subclavian vein, also we can see here the transverse cervical vein. Transverse cervical vein, also one of the content of the posterior triangle. So, as we see, the posterior triangle containing arteries, nerves, veins, and lymph nodes. Thank you.